Welcome to the Turn One Studio podcast. I'm Eliud Custodio with Turn One Studio, and here we sit with local business professionals. Today's guest, Dr. Jeffrey Reynolds from the Family and Children's Association. Dr. Reynolds, welcome.
It's a pleasure to be here. Thank you.
We're super happy to have you. So, First things first, we always start off our productions this way. What is the Family and Children's Association?
So we've been around since the 80s,
Okay.
the 1880s, and so we're 141 years old.
Didn't expect that.
As you could tell from our youthful appearance, I haven't been there the entire time. But now I'm privileged to lead a team of about 360 professionals. We provide 60-plus programs across the lifespan. We serve about 35,000 people in any given year.
Okay.
And that includes programs that range from a nursery school in the village of Hempstead to senior programs and everything in between. One of our big focuses for the past 10 years has really been the opioid crisis here on Long Island. And so we do run 2 outpatient treatment centers, 3 recovery centers, and a whole suite of services designed to help people who might be struggling with that. And then, as you know, post-COVID, mental health issues just went through the roof, especially for young people. And so we've got a children's mental health program, and again, about 60 some odd programs to carry people through the lifespan.
Fantastic. Are you exclusively Long Island?
We are, and we made that commitment. Look, our forebears made that commitment a long time ago, and there are tons of organizations in New York City, but there's also tons of needs out here in Nassau and Suffolk County. So we're constrained to Nassau and Suffolk County. Our furthest location east is in Riverhead, and we go all the way into the Queens border, and there's plenty of work to do.
That's awesome. That's a large headcount commitment for Long Island. I'm happy to hear that.
Yeah. So, and look, it's not necessarily getting easier. The hope is that we're able to lift people up long enough so that they can become independent and then not become clients anymore. And so everything we do is focused on lifting people up socially, health-wise, economically, and really fostering that independence so that they can be more successful and stay here and raise families and be successful in our own community.
I love it. That's wonderful.
Yeah.
As far as mental health, and you mentioned COVID, was there a spike during COVID, or are we just more in tune with mental health awareness?
I think both are true.
Okay.
I think the average person struggled a little bit during COVID with the isolation, with, not being able to go out and being a little bit stir crazy, as they call it.
Yeah.
So I think there's more awareness around it, but I also think a lot of people really, really struggled. And I think leading into COVID, there are a lot of folks that maybe were starting to struggle, and then COVID just pushed it over the edge.
Right.
And then the lack of accessibility of services really served as a barrier. And so you didn't have kids who could go to guidance counselors anymore. You didn't have folks that could just walk into clinics. A lot of them were closed. Hospital centers were busy doing other things and not doing behavioral health. And so I think, both things happened. I think, we're coming out of that, but there's a long-term effect. I mean, we talk about the long-term effects of COVID, and one of them is the mental health crisis.
And no one talks about that very often, and they
Right.
should.
It's almost like we all want to put it behind us. And
Well, you want to forget the negative, sure.
I absolutely get that, but there are folks that are still struggling with school avoidance, with depression, with anxiety, and those types of disorders.
How did you handle servicing the community during COVID? Were you doing
We
Zoom?
went telehealth, but we also provided services in people's homes. And so we
Really?
didn't shy away from that. So
Okay.
we worked right through COVID. We run, among other things, the only shelter for runaway homeless and trafficked kids.
Really?
And there, too,
Okay.
we saw a pretty big spike in needs because there were kids who were couch surfing. And suddenly those host parents were like, no, not anymore. He's got to go.
Yeah.
And so they wound up in our shelter. And so we provided services right through the crisis. The only one that worked a little bit more remotely were our staff that focus on the finances, the fiscal department, some of our development folks. But other than that, direct service staff worked right through.
Fantastic. So for those in the homeless community, how are they finding you as an opportunity for shelter?
Yeah, so we deal almost exclusively with kids,
Okay.
and these days trafficking is a huge issue in Nassau.
Anyone under 18? Is there a
Yeah,
range that you're seeing?
under 18.
Okay.
I would say the sweet spot is 15 to 18 in terms
Okay.
of what we're seeing. But there's lots of homeless kids on Long Island. Nobody necessarily sees them. It's not like New York City where you kind of trip over homeless folks and they're hassling you and that kind of thing. They're kids who are sleeping behind strip malls. They're kids who are sleeping in encampments off the Meadowbrook Parkway. typically when the economy turns, we see parents who turn to living in their cars and then give us their children at Nassau Haven to care for. So the kids aren't sleeping in the car too.
Get out.
And so these are all things that are somewhat invisible in suburban communities, but it's happening all the time. And so, as we're recording this, it's getting cold outside and we'll see a big influx. We saw it during COVID. And so there are peaks and valleys, but right now we're in a peak.
Wow. And I'm assuming you could help those parents as well with the example of...
We do. We always try to bring the family back together, right? It's not ideal that we care for your kid while you're sleeping in a car. And so we don't turn a blind eye to that. And so we try to treat the family as a whole. And that goes across the board. Whether we're treating, toddlers in Hempstead or seniors in Roslyn, we try to make sure that we're addressing the entire family's needs so that they don't have to go from organization to organization. There are lots of great not-for-profits across Long Island, but you shouldn't have to go visit 5 in order to get the services you need.
Well said.
Yeah.
Now, you had mentioned an increase in the opioid epidemic.
Yeah.
Why opioids?
Well, look, what are opioids used for? They're used for treating pain. And what started out as, I think, over-prescribing and aggressive marketing on the part of pharmaceutical companies quickly turned into people consuming them and saying, wait a minute, these work great on physical pain. Guess what? They also work awesome for psychological pain. Problem is that has an end to it. And so what we saw was folks who became addicted to prescription opioids got priced out of the market because the more you use, the more you need to use in order to achieve the same effect. Pills were going for $20 a piece on the street if you need to take 5, not to get high, but just to feel okay and not go into withdrawal.
Wow.
Somebody taps you on the shoulder and says, heroin's the same drug. It's a quarter of the price, and you're off to the races. And so we saw, heroin pick up, then we saw fentanyl, and now we see xylazine. And so we're in probably stage 5 of this, finally making some progress, which I'm really excited about. The fentanyl fatalities locally have dropped by about 24%, which is, we're not there yet, but every life saved means that there's one less empty chair around somebody's holiday table.
Right.
But now we're seeing a big increase in alcohol use. And so right now in America, alcohol kills more people than fentanyl. Fentanyl gets all the attention.
Yeah.
Alcohol is killing more people. So we try to take, a wraparound approach to this and say, don't chase the drug of the day. Let's figure out what's driving people to want to escape. Let's figure out how we create better connections so that people aren't using fentanyl, drinking too much, using whatever the new emergent drug is. And let's get everybody a little bit healthier physically and emotionally.
I'm surprised to hear about the alcohol issue, only because I hear about a lot of the younger generation just not finding alcohol as cool as the older generation. Is there a particular age range where alcoholism is becoming more prevalent than before, or is it just all over the map?
I think you're right about young people, and in folks under the age of 30, we've seen a wholesale flight to cannabis. And cannabis comes with
is that the substitution?
Cannabis also comes with its own set of potential consequences, although we don't fully know what all those consequences might be. I will say alcohol is a really deadly drug. And if we can reduce alcohol use, it's a step in the right direction. But one of the populations I worry the most about are seniors. And so if you think about it, seniors not going to work anymore, can drink and then get up at noon. Family maybe moved off Long Island, so you're by yourself. Your body weight and body mass has dropped precipitously as you age, which means that alcohol metabolizes very different in your body.
Right, more impactful.
You're probably taking medications. You probably don't weigh as much. And so all of those things conspire to create a whole new generation of folks that are really, really struggling with a major problem.
Wow. Are those folks, are they seeking help themselves?
No.
They're not?
No.
Is it a loved one that's
It's generally a loved one who's like, they're drinking day and night. Is this normal? No, It's not normal. And it has a pretty significant effect on your organs.
Yeah.
And so we work a lot to educate families about how best to have the conversation, what treatment entry could look like. There are more treatment options now than there have been like in the history of time. And so that's the good thing. But very often it's getting them out of the house, getting them into treatment, helping them understand the downside of drinking so much. And look, generally, there's not a lot of good education out there about how much alcohol is too much. Right. And does it vary by age? Does it vary by what condition you have? And, lots of older folks will say, so I drink 3 nights. Who cares? I'm not hurting anybody. Well, maybe not, but let's check that out.
Sure. Well, we've had people in the retirement phase of their life for a while. We've had alcohol for a while. Why now are we seeing an increase?
The isolation's greater. And here on Long Island, you probably have experienced this firsthand. there are lots of seniors that are left here on Long Island as families move down south or other places that are a little bit more affordable. And so we see that dynamic where there's seniors who are, I don't want to say stuck here because that's not the right term.
Right.
But they do wind up here and the rest of the family has moved somewhere else. And so that isolation, I think, is a little bit greater than it's been in the past. In addition to that, people are living longer periods of time. Right?
Okay,
So
that's a
people
good
are living
factor.
longer now more than ever before. And so you see more poverty, you see more isolation, you see more untreated mental health conditions. You just see seniors going through a lot behind closed doors. And again, our suburban nature and white picket fences, there's a lot going on behind those white picket fences. We just
Yeah.
don't necessarily see it all the time.
Oh, man, that's sad.
Yeah.
That's sad. People watching, how can they help your organization?
Or we could use it. And so we're at a
Yeah,
time
so how so?
where there is incredible uncertainty in the environment. So a lot of our programs are not fully funded by government
Okay.
or at all. And so there's the ability to make a donation. Our website is fcali.org. We always need volunteers, people to come and help out. We actually
Okay.
have programs where we send friendly visitors into seniors' homes to work with them. And so get involved. Contact us. If there's any way that you can help, we'll find a place for you.
Fantastic. Now, I know you wrote a book.
I did.
Let's share a bit about that.
So it's called Every Mile Matters, Turning Triathlon Training into Cancer Triumph. And so here's the short version of the story. It's April 1st, 2022. I'm driving down the Northern State Parkway to a dental appointment. Notification pops up on my cell phone. I log into my healthcare portal when I get to the light at 110 and the Northern State Parkway. Scroll through pages of medical jargon that I don't understand, and then I get to the punchline. The punchline says clinically significant prostate cancer likely. My cancer journey didn't start that day. It started with some routine tests in which I was just over the mark, but the doctor said, yeah, I don't think there's anything here, but we should check this out. Well, it turned into a full-blown prostate cancer diagnosis. It was somewhat perplexing to me because I had literally just finished Ironman Florida, which,
So you were healthy.
for folks who don't know, 2.4 mile swim, 112 miles on the bike, a full 26.2 mile marathon. If you don't finish in 17 hours, none of it counts. Start over.
Right.
And so I finished. But I was in the best health of my life. And I'm like, how could this happen? I'm a healthy guy.
Yeah.
And so for me, it was proof that it could happen to anyone. I got treatment in July of that year. Ran the New York City Marathon that November. I'm back. I battled this. Not the end of the world. Most men will get prostate cancer at some point in their life, and they'll die with it as opposed to from it. But by then, I'd become an evangelist for routine screening. I actually
Okay.
did a PSA for the Prostate Cancer Foundation of America. I had no symptoms, nothing wrong with me, picture of health, and it could happen to me. So I took my own advice and went for a colonoscopy the following year in August.
Okay.
You could probably predict where this is going based on the tone of my voice. And so I come out of the procedure into the recovery room. Doctor comes to me and says, hey, look, I found some polyps. I took them out. Nothing to be that worried about. But I also found a significant mass. And those words will stick with me forever because my immediate question was, well, like, how significant? And he's like, no, it's really significant. Get a referral on the way out. And so my wife and I literally thrown into a spin, and there I am Googling the test results. It wound up being stage 3B colorectal cancer. Survival rates are not the same for that as they are for prostate cancer.
Okay.
And you start doing the math in your head. I'm not a big baseball guy, but I know the 3 strikes rule. And I'm like, 2 cancers, 2 years, actually 2 cancers in 14 months. This is a lot. And so I went through the process, went through 27 rounds of radiation, 35 rounds of chemo, and it's been about 21 and a half months now with no evidence of disease. So the tumor is gone. I'm healthy. I'm good. I'm back to running and racing. I did Jones Beach 70.3 this year. I ran up the 86 flights of the Empire State Building as a fundraiser
did
for
that one?
NYU
Yeah,
Langone, which was just phenomenal. I ran with some folks on the medical team there. And so, I'm back. But for me, just connecting these two lives together, triathlon training gave me a lot of grit and determination, and so does running a not-for-profit these days because it's not for the faint of heart, let me tell you. But it also, I was the guy for 35 years that you called if you needed help. And so your kid overdoses, you call me and I can point you in the right direction. Your marriage implodes, I can help you. And suddenly I was the one on the other side of that equation, the one asking for help, the one who's Googling his test results at 3 a.m. trying to figure out what the survival rate potentially is. And so it was eye-opening for me. The other piece that was eye-opening is just how many people are struggling with so many issues out there, because once you have a diagnosis like this and you talk about it publicly, and I wanted to. I wanted people to get checked. I wanted them to get screened. In neither case did I have a single symptom whatsoever. And so I want people to know about it. But when you do that, people just come out of everywhere and say, so this just happened to me. I just got diagnosed. Can you spend 10 minutes talking to me? Yeah. People really going through pretty heavy things, including folks at FCA. And I continued working. My doctor said, like, you're not going to take time off. And I didn't miss 5 minutes worth of work. I was in my office. I had radiation at 7.
But that's a good distraction as well.
It was a great distraction. You know, I sometimes now like second guess it and say, you know, maybe I should have taken some time and really played that cancer card when I had it. But it was a great distraction. And it was almost like I was trying to prove to myself, look, I'm not that sick. I can still do this. You know, part of it was like, suppose this doesn't work out. Yeah. I want to make sure the organization is positioned in exactly the right way. But the other part was the diversion. And so on the days when I woke up and threw up from the chemo, I thought to myself, I threw up doing triathlons all the time. That's what you do. And you wipe your face off and you just keep going. Yeah. I did the same thing when it came to work. And on the mornings when I got into work and started doing things, I wasn't thinking about it. It was one foot in front of the other and doing the job. So I have a new appreciation for, I think, the sanctity of that helper-helpee relationship and things that happen in that. You know, it's not really the health insurers view it as a transaction, but there's a lot that happens in that exchange. And NYU Langone is one of those places where I didn't have high-level contacts. I know folks in all the other health systems, and the nice thing about NYU Langone is I didn't have to know anybody to get great care.
Okay.
And so,
do you go to the facility in Huntington, that large?
No, I go to Mineola. Oh. You know, and I'm not. You know, I get this. So I'm white, middle class, heterosexual, well insured, and able to navigate this in a way that not everybody is. And so there's lots of folks out there that don't have access to routine testing without huge copays, that wouldn't have the same access to care that I did. And so, you know, I'm trying to use this experience now to talk about some of those healthcare disparities that, quite frankly, result in people who would have had the same diagnosis I did not living to talk about it. Yeah. And so screening is something that's very personal to me now, as is eradicating those disparities. The disparities work is kind of what we try to level out at FCA. You know, healthcare disparities abound in our community, and people struggle with health conditions, mental health conditions, and, you know, poverty, homelessness, all the other things that impact communities across Long Island. And we try to level that playing field and give them just a little bit of support so we can all compete on an even keel.
Is that what your book is doing?
I think so. One of the things it's done, so it provides like a framework, provides some guidance to people who might know someone that gets diagnosed with cancer, including, you know, a controversial section on what not to say. You know,
so the book is not just for the inflicted abuse.
Yeah, it's for caregivers as well. There's a whole section on men's health and men's mental health and how we relate to each other and vulnerability. But I took some things out of triathlon training. I brought them into the cancer world, and now I want to share them forward. There is an entire chapter on healthcare disparities, and the best thing the book has done is people have gotten in touch with me to say, I just got diagnosed and I'm freaking out. Can you just talk to me? And I'm very clear in saying, all right, so I have doctor in front of my name. It's not MD. I'm not your oncologist. I'm just a guy who went through a cancer journey twice. And so to the extent that I can share with you my experience, my strength, and my hope for you, then I'm happy to do that, but understand the limitations of our conversation.
Yeah. Well, on a personal note, I'm very happy that you put out that sort of content. I don't remember if I shared this when we met. I'm a cancer survivor.
Okay.
And I'm going on almost 25 years.
Nice. Congratulations.
And even after all this time, it's still difficult to talk about.
Yeah.
I still have those memories. I'll watch something on TV.
Yeah.
For some reason, Hollywood loves cancer storylines.
Yes.
You know, and it's hard not to cry sometimes when you're watching even fictional content because it just draws something from you. I remember at that time, a friend of mine gave me Lance Armstrong's book. And with whatever his racing, his Peloton legacy is at this point, his Tour de France, and I don't remember all the details of the book, but I enjoyed the story. Yeah. And it was relatable, and I didn't get into athletic things till later. I ran the New York City Marathon in 2017 and 2018, and I did a boxing thing and whatever. this book was well before that, but I was still able to relate to it, and having those pages I found very helpful.
Yeah. I got into it later on in life, too. It was kind of like a midlife crisis kind of thing. So
Yeah, I guess I don't want to admit that that's what it was.
I dye my hair and get skinny jeans and cruise the community college, or I take up triathlon. And so it was like 5Ks became 10Ks, became half marathons, and then it wasn't good enough to suck at one sport. I needed to suck at three.
Hear you.
And so I went and took up swimming, biking, and running. But I will say it gave me a great outlet. And, you know, I'm almost 2 years out of this, but there is that anxiety that goes along with routine tests. I just finished another round of testing. I'm still part of a clinical trial. So every 3 months, I go in for a whole bunch of tests, including an MRI, a CAT scan, all sorts of stuff I don't want to talk about with you. But it's like every 3 months. And so you begin counting life in those 3 months.
It's a crappy reminder sometimes, right?
Yeah. And you go back to the same places, right? The same parking garage at NYU Langone. And I will say, you know, some of it comes with trauma, but it also comes with an incredible amount of gratitude. And so every time I get a clear scan, you know, it's like, all right, I've been given this gift. And that's the way I view it. You know, I think we tend to lose track of time. And so now there's little things. My ability to go out and run again is a gift. It's not, I have to go run 5 miles.
Right, you don't take that for granted anymore.
Right? I get to do this. You know, I will likely be around for my daughter's wedding, which is something that was up in question for a period of time. I got married in December, and so it's like, all right, well, now I'm going to be around. And so one of the great lessons I took out of the entire experience is, you know, all the things you wanted to go do them. In fact, I finished the book while on safari in South Africa, because I'm like, I always wanted to do that.
You're living life, man.
You never know what's going to happen. Yeah. You should go do it. And it sounds, you know, it sounds trite, but life can change with a text message on the Northern State Parkway. Like, just like that. You're going about your business, going to a dental appointment, and something happens, and it can change so quickly. And so I brought my friends and family a little bit closer. I've started doing all the things I wanted to do. I'm sharing the message out there in the world. I'm trying to bring my personal experiences in with my professional experiences in terms of how we support people at FCA. And just, you know, very grateful, especially this time of year.
Amazing. I heard recently someone say something to the effect of no one on their deathbed ever wished they worked more. That kind of stuck with me, and living life is important. You may have answered this with the triathlon stuff, but I always like to ask, what do you like to do for fun outside of work and
it's really swimming and biking and running. And these days, you know, it's an affirmation that I'm back. It's an affirmation that I can do these things. I exercise through chemo. I did not run 10 miles during chemo at any given time. And so I'm not back to where I was, but I exercised during chemo, and it was almost like a rebuilding. It was like, all right, so, and I bargained with myself. I'll run to the next stop sign, and then I'll walk for a little while, and I'll do that again and again and again. And these days I'm back to racing. I did a 4-mile race a week ago. I'm doing an 8K race in the next couple of weeks. And next year will be a big racing season for me. And so it gets me out there. It's an affirmation that I'm alive. It clears my head and keeps me grounded. And so that's what I tend to do for fun. That and come on podcasts.
Fantastic. And that's a great way to wrap this up. Dr. Reynolds, thank you for coming on.
Thank you for having me. I appreciate it. It's a pleasure.